retinopathy a role in poor visual outcome after cataract surgery? As we know that the anterior visual pathway is susceptible to damage from various toxins, the toxic retinopathy is a group of medical disorders which can be defined by visual impairment due to retina and optic nerve damage by toxins. The exposure of toxins can occur with ingestion of food containing toxins like bidi, gutka, smoking, tobacco, alcohol, and other things. These toxins can be directly lethal or they can lead to deficiency of certain vitamins in our body. So it can be defined as a clinical syndrome by damage which can cause damage to papillomacular bundle of fibers along with the optic nerve head, leading to central or centrocecal scotoma and reduced color vision. The aim of our study was to evaluate the cause of poor visual outcome of uncomplicated cataract surgeries, to evaluate the hidden burden of the toxins used in the community very grossly. In maximum number of cases which had an uncomplicated surgery and disproportionate loss of vision, the outcome was not very good. So this study was done to evaluate the cause. This study is a single center retrospective study. The cataract patients from low socio-economic strata and rural background were included in the study. In this study, few assessments were done preoperatively. Then the patients were subjected to manual small incision cataract surgery or phacoemulsification as and when required. The assessment done preoperatively were best corrected visual acuity on Snellen's chart, intraocular pressure by NCT, color vision by Ishara, slit lamps examination, fundus evaluation, keratometry, IOL power calculation, serum vitamin B6 and B12 level before the surgery and 1 month after the surgery. These patients were subjected to a very well-formed questionnaire. This questionnaire included what was the socio-economic data of the strata of the patient, to check what sort of background he belongs to, what is his total earning and what part of earning does he spend in food intake or in addiction like alcohol and other things. The exclusion criteria for the study was any patient who had any post-operative complication, even though if it was good for study, was excluded from the study group. Patients with post-operative astigmatism of more than plus or minus 2.0 diopter cylinder, patients with any other ocular pathology, mature and hypermature cataract, and patients having any underlying systemic conditions like diabetes, mellitus, hypertension, and any other chronic illness. Post-operatively, the patients were assessed for best corrected visual acuity on day 1, 3, 7, and 30. Final screening was done on day 30, where color vision, fundus evaluation, visual fields, and serum vitamin levels for B6 and B12 were repeated. Total 100 number of patients were included for one eye each, among which 72 were male and 28 were female. So there was a male preponderance. This is the age data of the patient. Median age was 65 to 67 years of age and age range was 50 to 72 years. This is a pie diagram showing the age distribution. Pre-operative signs which we took suggestive of disease were disproportionate defective vision. Disproportionate means the amount of vision which was defective was not correlating to the amount of cataract present. Defective color vision, which indicated defective vision for red. As the patients belong to a rural background, they didn't have a very good appreciation. So there was just a defective notification of red and green color. Fundus changes include toxic retinopathy, sort of a temporal pallor, distemporal pallor, and defective visual fields showed central and centrocecal scotoma. These patients were subjected to manual small incision cataract surgery and phacoemulsification, whatever required. After calculating the best corrected visual acuity at day 1, day 3, day 7 and day 30. Initially on day 1, the best vision was found only in 15% of patients. And when this total result was concluded at day 30, 81% of patients had diminished vision, which was less than 6/60, and only 23% of patients had a good vision. Toxic retinopathy was defined as defective vision having minimal optic nerve and retina involvement, showing distemporal pallor, defective color vision, and visual field changes. Coexisting factors in this was malnutrition as well as poor awareness. There is a very poor awareness of use of these toxins. These are used in a very liberated amount in the lower or rural background area.
Ma'am, time is over.
Yeah, sorry. 81% of patients with habit of smoking and tobacco chewing had the problem. And to conclude, the toxic retinopathy is a prominent cause of poor visual outcome after cataract surgery.
Ma'am, what is the common drug for the toxic retinopathy which is used in some general disease?
Sir, we gave only supplements of vitamin.
Then you have not considered hydroxychloroquine.
No, sir, we didn't take this thing. We took only the food material. We took only the
That
food
is
material.
very important,
Yes, sir, that is important, but we excluded such things.
Can you tell some other toxic drug routinely used in general practice and choroid toxicity?
Hydroxychloroquine. सर दूसरी नहीं एक्चुअली वी इंक्लूडेड ओनली फूड और फूड मटेरियल जिसका अवेयरनेस चाहिए था